Good morning, everyone. Another week of Wellness Wednesday. I am April Dupree, and of course, I have our resident fitness and nutrition expert, Mackie Shillstone. We are talking about the bootay today. Now, I'll let you tell the people the technical terms, but we're talking about the glutes, specifically
yes,
one area.
Well, actually, two.
Two. I'm sorry, two.
Okay, so when we talk about the hip, okay, and the glute max med. The med is really something you find out about in tennis because that affects everything from the knee to the shoulder.
Yep.
And then the minimus. The idea is you remember the comedian Rodney Dangerfield?
Yes.
He always would say what?
I gets no respect.
Okay, well, the hip gets no respect, but it is a game changer in sports and life.
Okay.
All right, so I read a research paper. I read it all the time at 5 o'clock in the morning, and I read journals, and this popped up. American College of Sports Medicine. The two things I'm going to show you turn out to be two of the most effective exercises for the glute max and the glute med, which are going to allow you to do this and abduct, externally rotate, which is the key and change of direction.
Okay.
All right, so I'm going to take 2 light dumbbells, and you can use heavier, but I'm going to get into a split squat position. Now, notice where I am. I want to be backed up, and and you see, I'm here to prevent what you're seeing me do. I want to get in a position that I've got balance.
All right.
All right. Now, the key on both points is that lead knee does not go over my toe. So you see my right knee, it's going to drop straight down. So this turns out to be it may be right up there in the top as the best glute max exercise for the main part of the butt.
Okay.
So I've got the dumbbells down, and I'm going to drop 1. Now, the buttocks I'm working is here. I'm going to drop down, drop down, drop down, drop down.
Gotcha.
Okay. What I'm going to do after that is I'm going to come over and I'm going to work what we've talked about before, the single leg Romanian deadlift. Now, I could use 1 dumbbell or I could use 2. And this is only a pendulum motion. Pendulum, rather. Notice I've got a bend. As I go forward, I pull the pendulum back, and the reason is because when I put my leg back, it's going to counterbalance this forward movement. So when I go over, I don't need to go all the way down. That's not doing me. I'm going to simply balance and come back up, and then I would switch. I mean, sure. I mean, I could go all the way down, but you don't need it. Notice I've got them in my fingers here, gripping. It's a pendulum motion. So and notice why I'm stabilizing, because if my knee is bent, I've got control. If I'm trying to do it like that, I don't have the control.
Now let me ask you, because some people may not even be that advanced to be able to balance on their own. Can they hold on to a stationary object and then do the rest of that motion?
Here it is. Here it is.
Perfect. Yeah, that way you're working the same muscles. You just don't have to worry about your balance, and it makes it a little easier.
Watch this.
Look at you. Okay, we see you got the knowledge.
Again, you think I'm working this one. I'm actually working here.
And you'll feel it.
That's why you have to do both sides.
Yeah, well, thank you guys so much. Such great information. Please try it at home. Visit Maxwell Nutrition to find all of this information, and visit www.tv.com and click on the Health tab. You'll find today's information and so much more that we've done over the last few years. Thank you so much. Join us next week.